Okay, let's talk about ACS donor scalp preparation. What is this? Well, it's autologous conditioned serum. It's a technique we use to prep the skin. We're talking about the donor skin, the skin where the hairs come out of, not the recipient skin. That has a different set of benefits to it. And it's preparatory. It's something we do prior to the procedure to obviously make the procedure go better or get the results better. In this case, we're doing donor skin preparation for high graft procedures. Now, a lot of times you have not heard other clinics talk about donor skin preparation because they're getting nowhere near the number of grafts required to implement this technique. We're talking about 6,000 plus grafts, usually 8,000 plus grafts that we need to deploy this for. And most clinics are only able to do 25 to 3,500 grafts in one session. Now, when we're removing a graft, we're actually taking out a core tissue. We're actually taking out a chunk of tissue that surrounds the hair shaft and the follicle. We're taking all that out. And as we take out multiple grafts, we're taking out multiple chunks of tissue from the skin. And that skin that's left behind is slightly devascularized. That means it no longer has blood supply coming in from 360 degrees. It has coming out from 280 degrees because we've taken out a couple grafts around it. And we need to make sure that skin survives. And if we plan to take out a lot of grafts, we want to do as much as we can to make sure that skin is healthy to support the extraction of that many grafts. Hence ACS for donor scalp preparation for the purposes of doing high graft counts, 6,000 to 8,000 plus grafts. So what is ACS? ACS is autologous conditioned serum. It's a wound healing therapy that we use to augment the healing of wounds. And in healing of wounds, a couple things need to happen. Number one, the blood flow to that wound needs to be ramped up. New blood vessels need to grow. Second, we need skin and hair stimulation to close up the wounds. So those remaining hair and skin cells, we do want to support them through this wound healing process such that they don't shed or that they close up nice and easily. So if we do ACS to the donor scalp now, about 1 to 3 weeks before surgery, we can really ramp up that blood supply. And in the procedure, what we see is increased bleeding. A lot of people say, oh my, you don't want increased bleeding during a procedure. That sounds like a bad thing. No, this is a great thing. This is how good surgeons can tell that things are okay, that the skin is healthy and it's going to heal just fine. And with this procedure, we see so much more bleeding. And it's a nice positive sign to us like, okay, let's keep going. Let's get 10,000 grafts. And this is one of the reasons we hold the world record, is because we do these kind of preparations. So if you're getting a high graft count procedure, you're going to want ACS donor preparation. I'll definitely advise you for it. It's included in micro because we're doing ACS for the recipient side anyway. However, if you're doing a standard procedure, this is something you might want to add in.